so much for joining us today. We are here with the Southeast Express Coffee Connect panel, healthcare that impacts you and your family, Southeast health, wellness, and health equity. Thank you so much for joining us. I'm Amy Galentine. I'm the great publisher for Colorado Publishing Company that includes our newest paper, the nonprofit paper, the Southeast Express. The Express is powered by the technical and logistical support of the Colorado Springs Indy, the Colorado Springs Business Journal, the Manitou Springs community-focused paper, the Pikes Bulletin, and the Colorado Springs Military Newspaper Group. Thank you for being here. Thank you to our Coffee Connect partner, KOAA, local NBC affiliate and news leader in Southern Colorado, for the collaboration to make these monthly conversations possible. I'd also like to thank My Black Colorado, as well as the Chinook Center, for the space to host today's healthcare panel discussion, and a special thank you to our panel sponsor, the Colorado Health Foundation. Please welcome one of this afternoon's moderators, Patrice Ravenscroft, who is the Chief Operating Officer for 6035 Charities and the Associate Publisher for the Southeast Express. Handing it over to Patrice. Thank you.
Thank you, Amy, and good afternoon, everyone. I have the pleasure of welcoming today's panel members, but first I want to thank Allison Zimmerman, KOAA multimedia journalist and anchor. We'll get right into it, but I want to thank our sponsor, again, Colorado Springs Health Foundation. Our first panel member, Kari Davis, is the Executive Director for Colorado Springs Health Foundation, a grant-making organization formed from the lease of Memorial Health Systems to UC Health. Previously, Kari worked as a faculty member, Yale University's Global Health Leadership Institute in Rwanda and Ethiopia. Kari has a master's degree in public health and business administration from Yale University. Kari, welcome. Our next panel member is Julie Ramirez. She is the founder of Daily Dose 719, a video series highlighting culture of Colorado Springs, Colorado, while shining light on health disparities in Colorado Springs, as well as desirable places in the U.S. Julie graduated from MSU Denver. She joined the local planning and grant review committee from the state's funded programming Transforming Safety and helped decide on $1.3 million of how the money would be spent in her community.
And our next panel member is Corey O. Arcaris, the owner of C-ARC Enterprises LLC Business Consulting. And Arcaris specializes in business lending as the contracted lending officer for Colorado Enterprise Fund. Corey has a bachelor's degree in marketing and a master's degree in accounting. She also serves as senior business consultant with the Pikes Peak Business Development Center. Corey is also the Value Care Health Clinic founder. Welcome, Corey. And our final panel guest we have with us today is Dr. Robin Johnson, currently practicing as medical director for El Paso County Public Health and serves as adjunct faculty for UC Health School of Medicine. Dr. Johnson has 28 years of medical practice and healthcare advocacy in the Pikes Peak region of Colorado. She received her doctorate in medicine from University of Colorado and completed an emergency medicine residency with Denver affiliated residency. Welcome to all of our panelists today. We've got a great afternoon here.
Great, we'll get right into it. Corey, this first question is for you. What have you seen in the healthcare space since you sold your clinic, Value Care Health?
I've seen some positive things happen, and we've seen some progress in Southeast in this space. We are now seeing that the city is moving forward in addressing the lowered life expectancy in Southeast Colorado Springs. We're seeing a plan move forward in that space. We all know that there is a lowered life expectancy in Southeast Colorado Springs, so that there is an effort underway to make sure that people know, and there is an increased awareness. While it is not a pretty number, we now know that we need to address it, and once people know, we can band together and we can do something about it. So to me, that's positive. It's progress, and we know that in dealing with it, that we can come together. So the City Planning Commission, to me, is a positive step in the right direction, because we know we're resilient, and that by working together that we can get something done. because research and resident planning, we know that by doing something from within is a good thing. So I've seen some progress. While it's not as fast as I would like to see it happen, I remain very active in this space because I care. I care, is one of the reasons that I founded the clinic, despite the fact that I'm not a doctor, I'm not a provider. I was not okay with the fact that 86,000 residents did not have primary care in this area. So I moved forward with it, but alongside me quickly came people that wanted to do something in this space. So since I've sold the clinic, Dr. Vu has taken that torch and done more and in that space and continues to do more. I stay connected with that organization, and they're continuing to do more in that space, and I'm very happy about that with their plans and for continued growth and expansion. So pleased that they're continuing to do more in Southeast.
Kari, our next question is to you. How has the Southeast region of Colorado Springs been incorporated into the Colorado Springs Health Foundation radar, and how has it advanced health equity directly impacting Southeast?
Sure. Well, first of all, thanks so much for having me today. This is fun. Get to see some familiar faces up here. So the main goal of Colorado Springs Health Foundation is to improve the health of the Pikes Peak region. And when we think about how do you do that, you automatically get focused on where are the biggest health disparities. Who in our community or where in our community is carrying an undue burden of our health challenges. And unfortunately, that leads you straight to Southeast Colorado Springs. Our Southeast Colorado Springs residents suffer disproportionately in terms of things like diabetes, asthma, heart disease, and the list goes on. And so for us, if we weren't paying attention to that, we really wouldn't be doing our job. And so what we've tried to do in our grant making is, number one, make sure that we're getting applications for funding from the southeast part of Colorado Springs, but also to make sure that we are providing grant funding specifically to the neighborhoods in Southeast, and that a disproportionate number of our dollars relative to other grants are going in that direction. So that's really how we've tried to address the health challenges of Southeast Colorado Springs. And I think it's fair to say we can do more. We'd like to do more. We know there's a lot happening in Southeast, and I think that's growing. And to the degree that our organization can partner with those efforts, we'd be very pleased to do so.
Awesome. Thank you, Kari.
All right, and Julie, you have this really cool project called Daily Dose 719. So we'd like to know a little bit more about where you got the idea and how did this all come to fruition?
Yeah, so when I had moved back to Colorado Springs after finishing up my degree, I wanted to get plugged into community, and here I was thinking for probably like a year or so, thinking like I'm the only one that wants to help Southeast, right? But when I got involved with transforming safety, I stepped into a room full of people doing amazing work already, and so I was like, does anybody know this is happening? This is crazy. And so I started a Facebook group, The Real People of Southeast, and the intention behind that was to highlight these people that were doing all of these things. And so then I kind of got caught up in the work. Fast forward to 2020, I was working with RISE on the Colorado Equity Compass, and part of that was telling stories and using data to tell those stories. And so I pitched this idea of Daily Dose 719. So basically same concept from The Real People of Southeast, but now, looking at everything through the lens of equity. And so far we've put out 6 videos covering social determinants of health. So everything from education to criminal justice to economics. And yeah, it's just been evolving since, and really excited to keep moving that forward.
And speaking of equity, of course, public health really just has been in so many headlines for the last year and a half, really. Dr. Johnson, can you tell us a little bit about how public health has put a focus on equity, health, and wellness?
Absolutely. Equity, health, and wellness are truly the bread and butter of public health. And we look at health and wellness from an understanding of full human flourishing. And we want to address health with an understanding that each person has a physical, a mental, behavioral, social, and spiritual aspect to them. And so how do we impact all of those avenues and keep those in balance as certain priorities may emerge and garnish more attention at a certain point? And to do that, we recognize that you have to really focus on social determinants of health. And that has become more common, but just so we're all on the same page, social determinants are those things that really drive whether or not we can stay healthy. They are access to healthcare, transportation, having a roof over our head, food security, a built environment in which we can get out and participate, getting sunshine and exercise. And those employment and education are also a piece of that, right? I mean, to be able to move forward with our dreams, but also to really care for ourselves and the people that we love and are responsible for. So we want to address health in all the places that we live, work, play, and worship. And it becomes imperative that we understand how these things integrate, how they direct us. And to do that, we, as Kari spoke to, we have to understand the data. We have to know who has what gaps in that area. We need to hear from the people in those environments and then set the table for us to come together to bring those resources. I say it's like setting the dinner table. I might have the turkey. We can get green beans over here from Kari, and then we bring in a little bit of stuffing. Before you know it, we end up having a full meal. We can accomplish things together that we could never do on our own. And I think that that is the other piece that public health brings. When we look at this, we recognize that it is in community and in collaboration that we will reach the equity, health, and wellness.
Kori, back to you. What do you feel is still needed now that you have this outside-in perspective?
A hospital, a hospital, a hospital. We need healthy foods. We need parks. We need trees. We need all those things in Southeast. But we need a hospital. How far away are you from a hospital when you live up north? And how far away are you from a hospital when you live in Southeast? Memorial Hospital is your hospital if you live in Southeast. But Memorial off of Briargate or Woodman, or, Penrose St. Francis, or, is your hospital if you live up north. But, what's your hospital if you live in Southeast? Your chances of dying from a heart attack or a stroke are much higher if you live in Southeast. So that hasn't changed. I had my clinic opened in 2014, and I sold it to a wonderful organization in Matthews View in 2019. We went from 0 to 5,000 patients in that short span of time. People pushed strollers, they pushed, they walked there, they came in droves in that short amount of time. We grew so quickly. And I'm a business consultant, right? And the people that were doctors came alongside and took over the clinic. I'm so grateful. But the right people came alongside. By the time I sold the clinic, Peak Vista had clinics. Diversus Health, who used to be Aspen Point, had clinics. There was a WIC clinic now, and I'm so very grateful that those folks came into Southeast to open their doors and their offices in Southeast by the time I sold my clinic. And Matthews Vu came in, Kari came along, and all kinds of people came alongside to help support my clinic. But what we don't have in Southeast is a hospital. If you're military, you go on base, you go to Bradley, you go, but there's no hospital. Can our tax dollars help support a hospital?
Thank you, Kori. And then Kari, back to you. We talked a lot about the residents in the Southeast and how they're experiencing these really difficult challenges. How do we go about changing that?
So it's a big question. I don't think any of us have a quick answer, but I think a lot of what my fellow panelists have mentioned really ties in. The first thing is, if you really sort of boil down what factors drives our health outcomes. So by health outcomes, I mean how long we live and how high quality our life is. We know that there are myriad factors that go into that. Healthcare is one of them, and it's a really important factor. And I would agree wholeheartedly with Corey that, we need a hospital in the southern part of our community for sure. However, there are many other factors that influence all of one's life course before you have that heart attack, right? And that's the thing that I think most public members don't understand. It's not because they're not thinking about it correctly. It's just because we focus a lot on those sort of end stage or really acute episodes that end us up in the hospital. And so I think it's a both and, so to speak. It's, yes, we have to make sure that we have amazing healthcare resources for everyone and that they are close by and user-friendly and culturally responsive to the diversity of our community. But I think we also have to look farther upstream. And by that, we really have to get into the social determinants of health that Jules and Dr. Johnson mentioned, which is, where do we live? How does that influence our housing quality, where we get educated, where we can find work, how accessible transportation is, and so on and so forth. Because those things, too, arguably have an even greater long-term effect than even access to health care.
And Julie, what impact do you hope this Daily Dose 719 has on the work being done in Southeast Springs?
So I see it playing out in a couple of ways. So I think about community and residents watching these videos and learning about health equity and all these social determinants of health, and also, taking advantage of the resources and opportunities that come from these videos or that are highlighted in these videos. And so I see residents watching these, taking advantage of the opportunities, and then being able to step into their power the same way I was able to once I got connected in all of this work. And so, once we have more people that really understand what we need to advocate for, then, pushing health equity forward more intentionally and at a larger capacity. And then on the other side, I want to help shift the narrative of Southeast Colorado Springs. And so really trying to help people understand, so RISE stands for resilient, inspired, strong, engaged. And that's what I know my community to be. And so giving people from outside of our community the opportunity to see who these people are and what we're doing. And, there's some leadership in the city that sadly they didn't even realize, the life expectancy was lower in our community. And now they're thinking about that. And now we can, show these videos to them as another way to understand what's going on. And so, yeah, that's a couple of ways.
Yeah, having those conversations, kind of like what we're doing here today as well. In terms of public health, Dr. Johnson, how has public health been involved here in the Southeast?
So we most recently began working in the Southeast with a build grant through the Robert Wood Johnson Foundation in the 2014 timeframe. And that was really to look at these aspects of health and the needs of the community by engaging the community leaders to really hear from them, but also to pull forward data that was being collected. And fortunately, in December of 2019, we opened up our Office of Data and Analytics, which if you've been following COVID, you'll see our little dashboard, which we're really proud of, because a picture is worth 1,000 words. If we can get these kinds of data points and we begin to have data sharing agreements across the community, we can have a full picture of what is happening so that we really identify those gaps and can begin to petition, advocate across the community, talk to Kari about what grants we can put forward. How do we collaborate to make this happen? So from that RISE grant, the Robert Wood Johnson Foundation grant, we worked to help institute the RISE Coalition. We were able to apply for an LPMR grant to further that in the work that had been initiated in the Southeast. We've been involved with the Panorama Park And we have had the opportunity to really reach into the Southeast through our providers. Peak Vista is in the Southeast in their Jet Wing location. Matthews Vu is there. We've set up opportunities for access to vaccination through these clinics and part of our vaccine consortium, but also in setting up the opportunity to bring mobile pods into churches and various other leaders who are trusted to bring forward the message that there is safety and efficacy, making sure we're reaching out to people where they live and work and breathe and play, so that we understand what they're bringing to the table. And we bring the education and resources that they need where they are.
And then Kari, back to you. Where are the places that we can celebrate Colorado Springs and the Southeast progress?
Oh, there's quite a bit, and you know, I know it seems sometimes that I'm gloom and doom, but there's a lot to celebrate. The fact that we are having this dialogue, yeah, I think it's great. Like Julie said earlier, when I first started, I felt like I was the only one, and I felt like I had to do something. And Amy came along and wrote a column, an opinion piece in the Business Journal, and I felt like I was the only one screaming, does no one care about these 86,000 people down here, you know, and their health? And I care. I want to open a clinic, you know, I want to do something. I use my 55-year-old brother passed away from complications with diabetes, and I used his life insurance money to open the clinic. And not many people know that, but I wanted his life to mean something. And when I sold the clinic, I felt like, you know, I broke even financially, and I feel like his life meant something, right? I broke even financially, and I feel like it was money well spent. That because we're having this dialogue, people care, and people care about the people in Southeast. That's something to be celebrated.
Huge celebration. Thank you for sharing that. And then Kari, to you. What are some examples of Southeast Colorado Springs initiatives that have the potential to improve community health status, and what more can be done in that area?
I'm going to answer your question, but I just want to acknowledge your loss, and also just thank you for sharing that, because I think a lot of times in these conversations we get overly academic, right? Especially people like me who love data and you know, it's about people, it's about families, it's about our kids, you know, and so thank you for that and for all the work that you did and are doing, and there's so many others who are doing work. But initiatives. Okay, so there's so many great things going on in Southeast, and the one at the top of my list is Panorama Park, which Dr. Johnson alluded to. So Panorama Park is right next to Panorama Middle School. It has to date been really sort of just a big piece of land that hasn't had a lot going on, you know, with it. However, through a lot of really engaged community members, there's now this amazing design for the park, and it's going to happen, which is the coolest thing. And it is going to be the most amazing park that the city's seen in a really long time, possibly decades or ever. I don't know. We'll see how it turns out. But what's really beautiful about it, and this is the way every park should be designed, is it's really driven by the community saying, this is what we want, and this reflects us, and this is where we're going to want to be. And so I just want to thank the many, many people in Southeast who have spent hours on that planning work. And I also want to thank, there's a lot of funders, including the City of Colorado Springs, who prioritize Panorama above other projects to be able to make it happen. And it's long overdue, quite frankly. Southeast hasn't had a great park in, well, maybe ever. So I think that's really exciting. I think it's exciting how there have been healthcare organizations now that there weren't when I first started in this job. I mean, it was a desert with respect to primary healthcare resources. Then Kari came along with Value Care, and now, of course, as was alluded to earlier, we have Peak Vista, et cetera. So I think that's positive. But what I really want to see, and this gets back to sort of the social determinants, those longer term factors that really make a difference in people's health, is I want to see Southeast continue to be resourced and supported to do more around education, employment opportunities, wealth building opportunities. Harrison School District, I think, is remarkable, and they should have more resources to support what they're doing. And those are longer term plays, so to speak, but I think that we really have to think about education, employment, transportation, economic opportunities, wealth building, those kinds of things, which Julie knows well because of her work with Daily Dose, but all of those things really do make a difference in our life expectancy, and there's more we can do.
And Julie, what are you most excited for as far as working in this community?
Oh, there's so many things to be excited about. So it's tough to nail down anything specific, but definitely Panorama Park is really exciting. Eager to see the Community Investment Trust be implemented. There is, Thrive has ongoing programs where I'm just really eager to see what businesses come out of there, and just in the whole economic realm in general, it's just there's a lot of momentum. But I guess specific to my work and Daily Dose, this summer, a lot of exciting new things coming. So I'm working with the Southeast Express to launch a podcast. And so we'll be having weekly podcasts launching real soon. And also have the Quad that's going to be helping to do research for these next 6 Daily Dose episodes, which we are going to be launching this fall. And so I'm just really excited to, keep telling the stories of community, because like we said, there's so much happening. And so I want to capture that and be able to put that out into the community. And, we're creating new ways to do it, and just trying to, really tell the story on a whole new level. And so really excited for that.
Yeah, starting with that awareness is certainly huge, and we've talked a lot about access here today. Dr. Johnson, can you kind of expand on how some of these underserved communities are receiving access to healthcare?
Yeah, so that is one of my real passion points. So having worked in the emergency room is a really great litmus test of what's happening in culture. And we kind of have an opportunity to tell, maybe be predictors of what's coming down the pike because of what's showing up at our door. In, 2008, with our economic downturn, it really became evident to me working in the emergency room that there was not adequate access to health care, and began really looking into the community to see what was going on, and got connected with our safety net clinics, which it's a long story of through the years now moving upstream into some of that prevention and now being in public health. I think that historically underserved communities have utilized emergency departments. They get creative and work with our fire departments or school nurses. There have been opportunities with the safety net, so organizations that come alongside and say, we need to provide access. Medicaid expansion certainly helped that access to care, because at least now there was insurance, there was the opportunity to step into that with more robustly for sustainability for the patients and for the providers. But we have more work to be done, and really looked at right care, right time, right place. So the fire department and the hospitals came together in 2014 around some of these overutilization of some of these services, and how did we impact that, and created some mobile opportunities with a CARES program, the crisis mental health of CRT and now Beacon. We also see that we're moving primary care into these spaces where we can find the data to say there's a gap. This is not only maybe a food desert, but there is also a primary care desert. How do we recruit and get physicians into that? They also we have to remember it's not just urban that are underserved. Our rural populations are underserved as well. And so there's advocacy for critical access hospitals, as well as, again, bringing primary care. From the public health, we have brought in a building into the fountain area and setting up WIC services that we partner to bring into other buildings, immunizations, and then additional opportunities for innovation and collaboration so that we are really learning from our partners what's working, that we can be on that cutting edge, to be the tip of the spear, to meet people where they, again, where they're living and where their needs are, and how they want to access healthcare. COVID's given us some opportunities with telehealth and some other innovations that have opened doors for us to really create a community that can thrive and be healthy.
Right. And of course, we can't have a healthcare town hall in this day and age without talking about the pandemic and COVID. But one of the things that we'd also like to kind of talk about is we know that there has been vaccine hesitancy, especially among communities of color. Where do we start in terms of addressing that? And I want to open this up to everyone. But Dr. Johnson, if you kind of want to lead, and then
Sure, I can
send it to all of our panelists.
kick us off, because we have the privilege of really working with this and had the opportunity to work with our minority leaders to truly begin to inform us about how do we reach people with understanding. And I think the first thing is to hear from diverse groups, and then to bring accurate information and education that addresses fears and myths and misinformation so that we can make sure people are making wise, informed decisions. And we need to find ways to bring those best practices to bear with personal ownership for individuals. And many times it's the story that will hit home, not just the data, to Kari's point and to your point in sharing your story. It is so impactful when we understand that we're not talking about, just one jab or shot. We're talking about the life that it protects, and then the contact of you with the others, and how that spreads across our community to create economic, social, and emotional, physical opportunities for us to thrive. So it is also, we need to find what your value proposition is. Is it in, the community opportunities that you have? Is it the opportunity to travel, or maybe go to a concert because now you're vaccinated and there's that opening? But our governor has given us an opportunity also to enter a lottery if you are vaccinated. So they'll pull that data, and that hopefully will inspire others to get vaccinated as well.
Yeah, I'll chime in on this. I'm not an expert like Dr. Johnson, but I definitely follow this closely, because I actually think that, aside from it just being such a relevant topic for all of us for the past year plus, it teaches us a lot about health equity and health disparities, and it's sort of been this really important case study that shines a light on a lot of other health issues. But the first thing I think of with vaccine hesitancy is the word respect. That people aren't just saying, oh yeah, I'm not going to ask any questions, let me go ahead and get the shot. That people are thinking about this, right? And they have strong opinions about it, and they may have lots of questions about it. And so we have to go into this with, first and foremost, a sense of respect. Respecting the fact that someone has a question or someone may not feel comfortable, and really understand that. And then I think the second thing that I think we've learned thus far is that a one-size-fits-all approach doesn't work. That different people have different concerns, have different questions, and so we can't just sort of blanket and say, you should do it because X, Y, Z. It just doesn't work. right? And it doesn't get to that respectful conversation that we need to have. So I think really trying to understand people's concerns and fears and speak to them, not in a way that's forceful or directive, but really just to try and answer the questions is the best way to go about it.
I will speak for the people I know in the Latino community that have chosen not to get the vaccine. I will concur to what Kari has said, that you can't just assume that the facts are going to sway their opinion, right? All kinds of factors come into it. Religion comes into it, and you can't just assume that these people are not educated, which to me initially was my thought. Oh, it's the people that aren't educated that or you just have to talk to them, and they're the one, and give them some facts, and maybe it's a language thing and they just don't understand, and you just tell them. That's not the case. Some very highly educated, I know an attorney who, who's a Latina, who has chosen not to do it. And I've just been flabbergasted, at her choice. But it's very much her choice. And so there's religion, and there's, she's thought through it, and she's, and she's chosen to wait. And so you can't just assume, you can't make assumptions based on how you think about it. And so you very much have to respect people's point of view, and people's decision. And at some point, they're going to make a decision for themselves and go forward. But one thing I didn't expect was the religion component, and how very tied, to religion it was going to be, how prevalent it was going to be, at least in my community. And I underestimated it, I guess I should say, for me and my inner circle.
Yeah, it's definitely interesting to have these conversations. So with Rise, we were kind of talking about how do we get some more people vaccinated? What are the things that are holding them back? And so we're definitely having those conversations, and also, there's efforts of getting this information into businesses, into just any location that will take the information. And so just being really intentional about making sure that the content, the information about the vaccines is out there. And then it's gonna come down to the individuals, and at the very least people will understand what it is they're getting into. So yeah.
We have a couple great community questions. We want to thank our KOA audience and the people joining us on Facebook Live. One question from the audience is, how can we address the social and systemic health issues as a community to keep people healthier? And we'll open it up to the panel.
Can you repeat that?
How can we address the social and systemic health issues as a community to keep people healthier?
Okay, so I'm gonna.
If we have none, we can.
I will
move to
just
the
jump
next.
into that. That actually is so broad and meaty. We could
That's
spend.
what I was thinking.
I'm thinking, wow, we could. Think between the four of us, we could spend a good hour just touching the surface. But I think the first and foremost is that when we think about systemic change, right, which is what we're talking about, if we're going to look at systemic health, we would want to have some sort of systems change, and it comes through collective impact. I really think it comes from sitting down at the table and saying, what are the outcomes that we are striving for? What does it mean to be healthful, flourishing, develop wellness, and all of these things that we've been speaking to this morning as a panel? And then what do we each bring to the table, and how are we willing to integrate those for that change? And while there are stories that help to drive this, we have to be good stewards of our resources. So we need to garnish that data to know the return on investment. Is what we're doing impacting what we think we are, or do we just kind of feel good about it? That's not worthwhile if we aren't moving our community towards the health that we really have agreed upon as a community is a priority. So we need to look at that return on investment for the sustainability of our agencies and bringing in some of those I call it braided resources and funding streams, right? Again, you have the turkey, I have the green beans. We're going to set a table. But I really think that we want to be good stewards of those resources, good stewards of our health outcomes, and ultimately we're keeping our people, that story of the person we love and that child for the next generation at the center of this. What are we passing on as our heritage?
You know, I have another thought around this. I agree with everything you've said, Dr. Johnson, and I keep thinking about sort of like what are concrete things that our community can do in order to address some of these bigger social determinants of health, as we say, the non-clinical factors that drive our health status. And part of it, I think, is sort of to Dr. Johnson's point about the collective, like a broader community understanding that health is driven by more than just healthcare. So that's a really critical first step. And then the second step of, sort of understanding our local data to be able to assess, of all the social determinants of health, are there one or two that sort of rise to the top that we need to look at in particular? One of the things, I don't know that this is the answer, but one of the things that I spend a lot of time worrying about is our safe and affordable housing issue here, i.e. we have not enough. And this is a really big deal for our community. And so, what if that were a key priority? And what if, as a community, we set a goal? And then, our elected officials, our community-based leaders, everybody began to work around the goal of, increasing our affordable housing units by XYZ. And that really became a priority when we make our decisions, when we allocate dollars, et cetera. I feel like some of that collective goal setting and commitment is really what's going to be critical if we're going to make any progress whatsoever. Otherwise, we end up working on it, but sort of in silos. And when you're talking about changing things like social determinants of health, housing, employment, education, these are massive, complicated systems, right? So it really does take a big and collective response to address those.
So I'm going to add one thing to that, and that is communication.
Yes.
Because if we're going to have this kind of collective, which brings in the work that you're doing, Julie and Corey, is getting that message out. You need to know that you're not working on it alone, so that these other individuals who are working on it, you begin to integrate that, and you create cross-pollination. You create ambassadors and advocates for these processes and initiatives. And then you break down the silos so you can bring in housing from what the city's able to do with what the continuum of care has initiated, or these other, and it's happening. It's happening. The other thing is you have to keep the long goal in sight. A lot of these things don't happen overnight, and so you can't get caught by what's expedient with what is the future and that long-term goal.
Right, and that was going to be my answer, was, there are 86,000 people or plus. I mean, we haven't gotten the new census numbers. It's probably going to be higher, right? But that's a large percentage of the total population of the city. And so those are taxpayers. And so there's a voice, and the elected officials advocate for Southeast Colorado Springs. But so getting involved, the Rise, the Rise Coalition is very, very involved in advocates of Southeast, but that's not enough. Getting involved, making sure that and understand what's going on. If you're not already part of the People of Southeast or the Facebook group, become part of it. Go make sure that you know what's going on in the community. Even if you don't go to meetings, make sure that you know what's being posted on there, and that, it's a great way for communication to get to you so that you understand. Did you know that life expectancy in Southeast Colorado Springs is 16 years less than everywhere else in the city? We haven't said the number today, but it's 16 years less. So if you take nothing away from today, it's 16 years less. Did you know that? Right? And so, at least be in the know about what those numbers are, and be, maybe not be involved by going and attending meetings, but the Harrison School District is amazing. They do amazing things. But that's how being involved in the community. Watch the Daily Dose 719. It's a great way to know what's happening in Southeast. And at some point, some way, something's going to hit you down deep. And it's going to make you say, hey, I'm going to get involved in that. For me personally, it was my brother passing away that I had all this grief inside, and this money, his money, and that I said, I'm going to go open a clinic. I can't do this. I've got to go do something, right? And I have the know-how to open a clinic, and I'm going to go do it because I just can't sit here doing nothing. I've got to do something. And I went out and I did something. And I said, somebody listen to me. If someone somewhere, luckily that somebody was Amy, right? And so the publisher of a really great newspaper, right? And so, but somewhere, along the line, you're going to say, I'm going to go volunteer at the Backpack Bash, or I'm going to do something. And doing something it may not be opening a clinic. It may be something else, but that something's going to matter.
All right, and one of the things that we've talked about today is certainly this need for a hospital in Southeast Colorado Springs, really the southern part of our area. So where do we begin with all of this? What do you guys think are some of the key first steps? What does that look like to reach that goal eventually? What are some solutions that maybe we can introduce in our community to make that a reality?
That's a good question. That's a great question. How does a hospital get built, right? Money. How did Memorial get built, right? It takes money, and I'm not the person to ask, so I'm going to be quiet now. I just say we need one.
I'll give you my opinion based on working for decades in the hospital industry around the country. The decision to build or not build a hospital is completely based on, number one, demographics, like how many people would use it, how many visits, et cetera. And secondarily, and perhaps more importantly, how much money you can make from that. Hospitals are like every business, they have to make a margin. And so, I think that there's no mistake that many of the newer hospitals have been built up toward the northern part of the city because of those two factors, right? There's more people who have moved to the north and eastern part of our community, so the demographics are there, the people are there, the need is there. And also the socioeconomic status of people in those areas tend to be slightly higher than, some of the other areas. So I think that it's those two factors that really drive hospital decision making around building a new facility or not. I will not speak, can't speak, not entitled to speak for our local hospital systems. They obviously, would have a much better answer than this, but that's what I've seen in my travels.
Before we get to the next audience question, we do have a comment from our Zoom guest. It says, I don't have a question, but want to thank everyone who is on the panel today in the areas that they work on. A shout out to Kari and a combination of the critical work that she has done with emergency responses, like hospitals for the people who need them, and to Kari recognizing we need systematic work to keep people from needing the hospitals as often going forward. And also thank you guys, because this has been amazing. So let's talk about facing barriers. So how do we encourage our community members in the Southeast who are trying to advocate for their health but are facing equity barriers? whether that's resources, programs they might not know about. How do they continue to fight for their health, fight for maybe the things that they're not seeing in the Southeast that are available to other communities?
So I'll speak on Thrive a little bit. Obviously, I'm a huge advocate for Thrive because I went through it and I created my whole business concept going through Thrive. But the intention behind Thrive is to solve community problems through entrepreneurship. And so it's a way to, create your own job for yourself or for the people around you, but also like addressing real issues within our community. And so, for example, I want to open a coffee shop, Stomping Grounds, and I really envisioned that being a space for like-minded individuals, entrepreneurs, business people that want to have these conversations and help address the things that are happening in our community, because as you all know, there's not a coffee shop in Southeast other than Starbucks. That doesn't count. And then we've seen so many other businesses come out of that, in the health and wellness realm. Yoga with, Sammy Black, everything she's doing, it's really addressing the individuals, but ultimately that impacts the bigger picture. So Thrive is one of them. Rise is always looking for people to get involved. We have VIP meetings monthly. I believe the next one is next Thursday, maybe the following Thursday. That's a couple of ways that I feel like people can get involved.
If they're specifically trying to advocate for their health and they're running into roadblocks, I would say number one, don't give up. It's your health. You're always going to be your best advocate. Someone else is not going to come do it for you. We have resources in this city. Amy Utzi's group, I forget the name of it.
CCHA. I'm not sure what that is.
CCHA, I forget what the acronym stands for. But CCHA is a great organization that helps people on Medicaid, and they could look it up online. They're a wonderful organization that helps people. They have care navigators that help with that, and there are resources. I would start with their primary care provider, and if that is not working, then try something else. But I would encourage them not to give up. It is not easy. Sometimes you're waiting for a referral. I'm a cancer survivor, and I've got to say that I've had to navigate and be my own advocate, and it is not easy. And my advice to them would be not to give up.
I'd also like to add, I think getting involved within your own neighborhood is super important, because as we've talked about, like, it's housing, it's the sidewalks, it's the lighting in your neighborhood, it's all of those things that ultimately will impact your health in the long run. And so if you do have a neighborhood organization, like, start there, and then I can see working your way up from there. So.
And I would just add, get to know your elected officials, right? They're there to serve you. Get to know who represents you, and call them. You would be surprised how much influence they can wield. And I'm talking about elected officials not only locally, so your city council people, your county commissioners, but also your state representatives. And don't be afraid. They want to hear from people like you. They're in their jobs because of people like you, right? So that's another way that you can advocate for sort of broader systems change, not necessarily individual health issues, but broader systems change within our health system.
And I always think curiosity is key. Stay curious about what is happening. There's not just the one path that's traditional. We're seeing so much innovation that is coming forward, and the development of new opportunities to seek health, and continue staying involved in your neighborhood, but networking. The more that you talk about it, the more that you learn from others, and the more connections you make to hopefully bridge those gaps that you're experiencing personally, and potentially for your loved ones.
We have just a few more minutes left. So I know we kind of talked about that the getting a hospital here, that's going to be kind of a long-term thing. Are there other healthcare specialists or specialties that you guys feel is a main priority that needs to be brought to the Southeast? And I'd like to open up for that discussion as what you think is the most urgent, pressing need, and how do we go about bringing those here as well?
I would say more primary care is always needed. You know, the more we can bring to Southeast instead of needing to send Southeast out of Southeast is always good. People can stay, if they can stay closer to their neighborhoods, or the closer they can stay, the better for them, I think.
And I would say mental health is probably a really big thing that is a little more tangible that we can start focusing on and bringing more resources into our community. Chronic stress has really bad effects on your body, and so the more we can, you know, make sure people are getting the help that they need. You know, we just recently had a major tragic event happen in Southeast, and you know, you can't help but think if only this person had help. And so just having more opportunities for people's mental health to be good. So I think that's something way tangible we can start working towards.
I'm a big fan of school-based health clinics. This is a great example of what Dr. Johnson was talking about, of access, really bringing services to where people are already versus expecting people to go to those services. And there's some really amazing models. Locally, we certainly have a couple of school-based health clinics, but I think we could do a lot more with that. And especially if they're integrated, mental health and physical health, and available to the students' families as well. That just creates sort of a one-stop shop that is often very inviting, a place people feel comfortable with already, and may really make the resources that both Corey and Jules were talking about more accessible.
Especially when there's a language barrier. Mm-hmm. Absolutely. And doing more with telehealth. COVID brought on the introduction of telehealth for many, many families, and I think continuing along that as we start to emerge from from COVID, continuing with more telehealth, I think, is a good thing. We had it at Value Care pre-COVID, and along with mental health, and I think it was a really good thing. And I would like to see more of that continue as people got more comfortable with it during COVID. I would like to see that, because that is access to care, and it would give people more options, especially essential workers that work late and don't have the option of, you know, your traditional appointments, the 8 to 5 appointments. And, you know, my brother, who was a truck driver, often missed his primary care appointments because he was on the road. And so telehealth would have been a good option for him. And so, you know, being more flexible and access, that would have been wonderful. Making sure that we're being more flexible for our essential our essential workers, many of who live in Southeast, things like that.
And I'm sorry to cut this short, but that is all the time. We're wrapping up this hour. A huge thank you, though, to all of our panelists who joined us today. Really great discussion as far as healthcare here in Southeast Colorado Springs. And Patrice, I'll have you wrap things up for us.
Absolutely. Thank you to our panel members. We want to thank Colorado Springs Business Journal, the Colorado Springs Independent. On behalf of Southeast Express newspaper, we want to thank you again for our today's sponsor, the Colorado Springs Health Foundation. Please mark your calendars for the next Colorado Springs Business Journal COS CEO on June 10th with Sean Willickson. For details, you can visit Colorado Springs Business Journal, which is csbj.com. And also stay tuned for southeastexpress.org events. And our next Southeast Coffee Connect with KOAA will be this Friday, May 28th at noon. So we'll see you again this week. We'll be with the business development in Southeast, the City of Colorado Springs, Exponential Impact, Colorado Enterprise Fund, and Thrive will be joining us. I'm Patrice Ravenscroft, Associate Publisher for Southeast Express. Thank you all for joining us.